Hello and welcome to JAMA Network Open Conversations. I'm Angel Desai, Associate Editor for JAMA Network Open. Today we are speaking with Dr. Brandon Del Pozo and Dr. David Mitre-Becerril about overdose prevention centers, crime, and disorder in New York City. Welcome to the both of you. To begin, can I please ask you to introduce yourselves?
Sure. Thanks for having us. I'm Dr. Brandon Del Pozo. I'm an assistant professor of medicine and public health at Brown. And prior to that, I served as a police officer in New York City and Vermont for 23 years.
Thank you very much for the invitation. My name is David Mitre-Becerril. I'm an assistant professor at the University of Connecticut School of Public Policy. And my background is in criminology, so my research is about public safety and community investments.
Thanks to the both of you for coming on today. I'm really excited to talk about your study. This is clearly a very timely and relevant issue of public health importance. Could you start by giving a brief overview of the background of the study and the context?
So it should be no surprise to most listeners that the overdose crisis in America has really just reached and stated historic proportions. Over 100,000 Americans die a year of preventable drug overdoses. Overdose prevention centers have been around in Europe for a while, also Canada. They're places where you can consume drugs under supervision to prevent overdose, especially in the case of consuming opioids. New York became the first state in America to sanction officially to overdose prevention centers because they involve doing what remains illegal in the US. For the longest time, there's been really intense opposition to these centers. And it's not because they don't save lives. They do. There's never been an overdose death in an overdose prevention center. But people worry that they'll be sort of like a magnet for illegal activity. They'll be a magnet for crime, that if you start offering consumption at a needle exchange, for example, disorder will gravitate toward the place. And so that's quite a big factor when you're making a public health argument for these centers. Since the New York State one and New York City have been open for about a year, we got it in our head to see if there was an effect on crime and disorder when the sites open.
And so with that context in mind, that was fantastic. Can you walk us through what you did in the study?
Yes, the main concern whenever we are analyzing these kind of case studies is how do you compare the intervention site to a very good or appropriate control? So in this case, we use a method called difference in differences that has been well used in social sciences and many other fields, which is just trying to compare a group that was intervened or that have, in this case, the overdose prevention sites relative to some other areas that they were going to be similar, except that one of them got this intervention and the other one didn't. And both of these groups that you are going to choose, the main key assumption in order to make them a very good comparable group is that they were going to follow the same trends, meaning the same changes over time until the intervention hit or started. So we use this method of difference in difference using different control groups in order to make sure that our associations were capturing the effect or the estimate of opening as overdose prevention site rather than just another confounder.
There were 19 brick and mortar syringe service programs delivering services in New York City at the end of 2021, when two of the 19, became safer injection sites, became overdose prevention centers. So what we ended up doing was comparing the changes in crime and disorder to the two that became overdose prevention centers to the other 17 that were operating business as usual throughout the entire period, which I thought was a really nice way to compare apples to apples.
Yeah, absolutely. What were your main findings?
Our main findings were twofold. One, crime and disorder wise, you could sort of call it a whole bunch of nothing, meaning that there was not a significant change that we could detect in almost every aspect of crime and disorder around the sites. We looked at 311 calls, which are quality of life related calls. We looked at 911 calls, which are calls about crime, about medical emergencies. We looked at complaints of crime by citizens. We looked at arrests. We looked at tickets. And really, within the levels of statistical significance, there were not many changes that were significant at all. And when there were, for example, homelessness related calls went down. That was a significant result. But trespass calls, drug related calls, nuisance calls, unsanitary conditions, those didn't change. But to some extent, the buried lead of our research is that the police pretty much stopped enforcing drugs around the safe consumption sites. That's the strongest and most unequivocal finding, is that around those sites, the police made many, many, many fewer drug arrests, and it was quite significant.
And I have so many follow-up questions to this, but just to take a step back, so given the time period of this study, is it possible that the COVID-19 pandemic could have affected the findings in either direction? And how did you perhaps account for that?
Yeah, it can be possible, but it will not be affecting the results like differentially between the intervention sites and the control sites. And that's the main thing to consider, because to the extent that that didn't happen, then the only other concern is that what would have happened if the overdose prevention sites were to be open in a moment where COVID was not around. Then it speaks about the external validity of our results, meaning that, again, in a different period, probably the effects may have been different, but does not by any reason invalidate our findings, because there's no reasons to believe why some neighborhoods, particularly the ones around the overdose prevention sites, may have been hit differently by the pandemic to our control groups.
And you've mentioned that there are these sites that have been established in other countries outside of the US. How do these findings track, or how comparable are they to potentially studies that are in other locations or other contexts?
So, one of the things I really enjoy doing is teaching a class on international drug policy at the Master of Science in Addiction program at Georgetown. And we take this up. We take up the idea of overdose prevention centers or safer injection centers, whatever you want to call them, in the international setting. So Europe has done a fair amount of research on this. Canada has done a bit of research. And our findings accord with the research in those settings. One of the things that they note is that the community often has misgivings, but then as these sites operate, attitudes soften. People see they aren't public health horsemen of the apocalypse. The studies also find, and we found this as well, that we see homelessness related calls decreasing. It's very, very plausible when people who would otherwise inject in public places because they are unhoused, when you offer them a place inside to consume, they go there instead, at least a proportion of the time, and that reduces the burden on the broader community. So those results here comport with results in Europe and elsewhere.
That's great. And clearly, this is a topic of international but also domestic interest. And without venturing too far outside of the scope of this study, what would you say are some of the broader public health implications of your findings?
We're hoping that this study has the opportunity to make a contribution squarely at the intersection of public health and public policy, if there ever was a difference between the two. If you look at, for example, Philadelphia right now, the city council has preemptively banned safe consumption sites, said, nope, we don't even want you to have the idea. In New York City, the U.S. attorney for the Southern District has said these sites are unlawful. I may shut them down. And when you really probe the arguments, a lot of it comes down not to the idea that they save lives. That's already well established. It's about the fact that they are sort of like havens for illegal activity and crime and disorder. Based on the data we have, looking at the first year of operation of these sites in New York, you cannot reliably draw that conclusion. You cannot conclude that these sites increase crime and disorder, that they're a magnet for any negative outcomes for the neighborhood in that regard. So if that's what your policy argument is about, our data says you really can't confidently say that if you're taking a position.
Are there any plans for any additional or next steps related to this work or potential future work that you'd like to conduct in this area?
When it comes to our public health and medical responses to the overdose crisis, I think we're at a really critical time in America. We're looking at decriminalization in Oregon, partial decriminalization in Washington State, in Rhode Island and Vermont. They've decriminalized, for example, unprescribed addiction medications. Here in New York City, there are overdose prevention centers that are fully sanctioned by the government. And it's going to take time for us to understand which of these interventions work, which ones don't work, which ones should be expanded, which ones should be modified or even stopped, right? But we can't just fly off the handle and go with our gut or go with our fears or our stigmas or our instincts. So I'd like to think of a study like this as a little beachhead in laying down some evidence about how to respond. I know the National Institute on Drug Abuse has funded a multi-year study of these overdose prevention centers that should yield some very important insights. But I also think we need to do more systematically what David and Aaron and I have tried to do in the study, which is look at these interventions in Oregon and Washington and here, give them some time, and take like a really thoughtful, rigorous approach to seeing whether they work or not. Then we can figure out where we should go with public policy. But we can't just go about it blindly.
And to complement those ideas, I will say that we have to keep in mind that this is one study for one single city. Therefore, we need more studies, also from different dimensions. In our case, we analyze public safety, but opening these overdose prevention sites have different dimensions on the neighborhoods. Public safety, the healthcare and many health-related outcomes, even urban development, safety concerns, or any other citizen concerns that residents may have about the feeling, how they're feeling safe, are they feeling unsafe. So there are many other margins that definitely need to be considered. But that calls for more research on this area. And also that calls for more support in researchers conducting these studies, either being open to the idea that we have to analyze them, examine them, so we can, based on evidence, say whether they are working or not, rather than just or try to make our decisions based on some prejudice or some just feelings or just by our gut or what our instincts may tell us. Because studies like these ones, based on evidence, they're very helpful to guide us and also to society and also for policymakers to guide them on what kind of decisions people can make and what could be the possible consequences of those decisions. Sometimes could be good, sometimes there could be some negative effects. In this case, for this study, we are seeing that at least for public safety, there seems to be no increases. So that could say that, yeah, at least on that end, people should be less concerned about opening these safe injection sites.
Before we wrap up, are there any final thoughts regarding this topic?
Maybe if there's one takeaway, it's that syringe service programs in cities like New York, large cities, already exist in areas that are vulnerable, often underserved, often with the greatest need for these resources. So if you have a brick and mortar syringe service program operating in a place like that, delivering its value there, adding the service of supervised drug consumption to that site, at least according to our study, does not change the crime and disorder around that site. That, I think, is the strongest takeaway. And then we need to unpack what it's like to collaborate with the police. The findings suggest that police stopped enforcing drug laws. That's a very strong finding of our study. And yet 911 calls and 311 calls in crime did not go up. So the sites were given a chance to succeed on their merits. The police, by all our data and by some of the popular accounts, by the support of the mayor that we've been very clear about in New York, have allowed these sites to operate without interference, and it did not have a negative effect on crime and disorder.
That's a really great thought to end on. Thank you so much to Dr. Brandon Del Pozo and Dr. David Mitre-Becerril for speaking with me today about this very important, very relevant topic. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.